Hello and welcome. Today we're diving into a really powerful group of drugs, central nervous system depressants. Now, these are the substances that can do everything from helping you get a good night's sleep to making major surgery possible by literally changing our state of consciousness. So that's the big question we're tackling, right? How can one type of chemical be used for something as simple as a sleeping pill, but also for something as profound as general anesthesia on the operating table? It's an amazing look at how these drugs play with our brain's wiring. So let's dive right in. All right, so probably the easiest way to wrap your head around these drugs is to think of them as a kind of dimmer switch for your brain. You know, they don't just flip a switch to on or off. Instead, they work along this whole spectrum, and the effect you get really depends on the drug and, just as important, the dose. So think about it. At a really low dose, you get sedation. That just means your physical and mental responses are kind of turned down, but you're still totally conscious. Now, turn that dimmer dial up a little more, and you get what's called a hypnotic effect, which is basically a state that looks and feels a lot like natural sleep. And then at very high doses, that same class of drug can bring you all the way to anesthesia. It's all about how much you dim the lights in the brain. So let's start on the lower end of that dimmer switch. We're going to talk about the drugs specifically designed to help us sleep, the sedative hypnotics. These are some of the most widely prescribed medications out there, and honestly, for very good reason. I mean, the scale of this problem is just huge. Somewhere between 10 and 30% of Americans deal with insomnia, that feeling of not being able to fall asleep or, just as frustrating, stay asleep. With that many people struggling to get rest, it's no surprise that the search for better, safer sleep aids is always ongoing. The first major players on the scene way back in the early 1900s were the barbiturates. And look, they worked. There's no doubt about it. But they came with some serious risks. We're talking a really high potential for both physical and psychological dependency, not to mention a whole list of other side effects. That's why you barely see them prescribed for sleep anymore. But then, in the 1960s, we got a game changer, benzodiazepines. These drugs work in a much smarter way. They actually boost the effect of something called GABA, which is the brain's main inhibitory neurotransmitter. So instead of just forcing things to shut down, they basically turn up the volume on your brain's own natural calm down and relax signal. And this comparison right here really tells the story. With barbiturates, you had a high risk of dependence and a pretty narrow safety margin, meaning the line between a helpful dose and a dangerous one was way too thin. Benzodiazepines were a huge improvement with lower risks. But, and this is important, even with these improvements, they're still really only recommended for short-term use. Of course, the search didn't stop there. Science has kept pushing, giving us even newer classes of drugs. You've got non-benzodiazepines like sulpidem, which are much more targeted specifically for sleep, and then melatonin agonists, which work by tapping into the body's natural sleep-wake cycle. It's all about getting more and more specific. But here's the thing. No matter how sophisticated these drugs get, using medication to bring on sleep is a very delicate process. It comes with its own set of risks, and it's just not quite the same thing as falling asleep naturally. Yeah, these meds have some unique side effects. You might get a hangover feeling the next day, that residual grogginess. If you stop suddenly, you can get REM rebound, which means really vivid, intense dreams. And over time, you can develop dependence, where your body feels like it needs the drug, or tolerance, meaning you need more of it to get the same effect. The bottom line is, chemically induced sleep often comes with trade-offs. Now, this is an absolutely critical point of caution, particularly for older adults. You see, as we age, our bodies just don't process drugs in the same way. These long-acting sleep aids can build up in the system, and that can lead to some dangerous side effects, like confusion or even an increased risk of falls. It's a perfect example of why medication choices have to be carefully tailored to every single person. Okay, so we've been talking about the lower settings on our dimmer switch. Now, let's turn that dial all the way down. We're shifting gears from the drugs that help us sleep to the ones that make modern surgery even possible. We're talking about anesthetics. And there are really two main categories here. General anesthesia is what most of us think of for a big surgery, a total loss of consciousness, because the entire central nervous system is depressed. Local anesthesia, on the other hand, is way more targeted. It just blocks pain signals in one specific spot. Like when you go to the dentist, you're wide awake, you just don't feel any pain in that area. You know, modern general anesthesia is rarely about just one single drug. Anesthesiologists use this incredibly smart technique called balanced anesthesia. It's basically a precise cocktail where every single ingredient has a very specific job to do. One puts you to sleep, Another one manages pain, another relaxes your muscles. This approach means fewer side effects and a much safer, smoother recovery. Administering this cocktail is really both a science and an art. It's all about guiding a patient through these carefully controlled stages of unconsciousness and then bringing them back again, all while making sure they're completely safe every single second. This whole process is actually broken down into 4 distinct stages. Stage 1 is the induction. That's where you lose consciousness. Stage 2 is called the excitement phase, and the goal is to get through that one as quickly and safely as possible. Stage 3 is a sweet spot. That's the stable level of surgical anesthesia where the operation happens. And stage 4? That's the danger zone, a toxic stage of overdose that has to be avoided at all costs. And making sure a patient moves safely through those stages, well, that starts long before they even see the inside of an operating room. A really thorough pre-surgery assessment is vital because everything, your age, your health, even habits like smoking or drinking, can totally change how your body handles anesthesia. It's all about making a personalized plan. Now, beyond general anesthesia, there are also these advanced techniques like spinal anesthesia. This is where a local anesthetic gets injected right into the fluid-filled space around the spinal cord, and it just numbs the body from that point down. It's fantastic for certain surgeries, but it can sometimes cause a specific side effect, a spinal headache, which comes from a temporary change in spinal fluid pressure. So we've seen how these drugs work, all the way from helping us doze off to enabling incredibly complex surgery. But the single most important ingredient in using them safely, well, it's not something you find in a bottle. It's the human element. And really, this is what it all boils down to. Whether we're talking about a sleeping pill or an IV anesthetic, these substances are incredibly powerful. They aren't simple fixes. They are potent tools that demand respect, deep expertise, and just constant vigilance from the professionals who use them. And this is what that vigilance looks like in the real world. It's this continuous loop of care. Nurses are always assessing a patient's history and their vitals, constantly monitoring their breathing, using safety tools like bed alarms for patients who might be confused. And this is huge, teaching patients how to safely manage these powerful medications once they go home. It's about building a total safety net around that person. And that right there is the whole point. The science gives us these powerful molecules, for sure, but it's the application of expert clinical judgment, that careful assessment, the constant monitoring, and the smart decision-making by trained professionals that transforms them from potentially dangerous substances into the safe, life-changing medical tools we all rely on. And that just leaves us with one final thought to chew on. We've gone from these kind of blunt instruments like the early barbiturates to these highly targeted drugs that work with our brain's chemistry. So as our map of the brain gets more and more detailed, you have to wonder, what will the next generation of these drugs make possible? What new doors for rest, for recovery, for treatment are they going to unlock? Definitely something to think about. Thanks for joining me.